Hello, my dears. This is Ariel Perkypile, owner of Enhancing Doulas, and today we're going to be talking about physiologic birth. We'll cover the basics like what is physiologic birth, why you should care, and how to go about having one. It's really interesting and it's going to be a lot of fun, so let's get started. Since we're just covering the basics today, let's start with a basic definition. What is physiologic birth? Well, let's start with physiologic. The word physiologic refers to the body's normal or healthy functioning. It's related to the word physiology, which is the study of the body's normal or healthy functioning, and pathophysiology, which is the study of the body's abnormal or diseased functioning. Of course, we all know what birth means, but here we're really meaning birth as in the full spectrum of childbearing, from pregnancy to the fourth trimester, that first few months after baby comes, and extended through as much breastfeeding as goes on. So physiologic birth is the normal or healthy functioning of mom and baby from pregnancy to the fourth trimester through breastfeeding. And I'd like to point out that there is a huge range of variability here in what's considered normal and healthy. So some babies may be term at 38 weeks. Some babies may not be ready until 41 weeks gestational age. You might have your water break before contractions start or not until baby's almost born. You might have a relatively short labor. You might have a labor that seems like it goes on forever. And that's all within the range of what is normal and healthy for you and your baby. You can think of physiologic birth as what will happen if we just leave mom and baby alone. Mom will be pregnant, labor, give birth, nurture her baby, breastfeed, everything will go well, right? And this is accomplished with just 4 key hormone systems. And of course, it's a lot more intricate and wonderful than just a list of 4 things, but also it's kind of this easy to understand. First, there's adrenaline. It also is called epinephrine, and there's a whole set of stress hormones that go along with these. This is what drives your fight or flight response that we've all heard about, and we're going to talk about that later. Next, there's the endorphins, the powerful pain-killing hormones that your body increases before you even start labor. Oxytocin is familiar because it causes contractions in labor. There's even a synthetic version called Pitocin that many have heard of. But most people aren't aware of oxytocin's many other effects on baby and on both parents that go way beyond uterine contractions. Prolactin helps with the production of breast milk, but it does so much more, beginning in pregnancy and continuing throughout labor and birth. The systems that regulate these 4 key hormones are so complex and intertwined that we still don't completely understand how they work. And to really complicate things, the fetus and newborn have their own version of these hormone systems, but the hormonal systems of mom and baby work together as one. It's so amazing. But as complex as these systems are, we do understand their purpose, to have a healthy mom and healthy baby. So the term physiologic birth is relatively new, but if you look at it that way, it's really our oldest priority to continue the future of our species. And if it seems like we're shaking things up with this idea, remember, physiologic birth is evolutionary, not revolutionary. Because physiologic birth is how birth is designed to work, it has many benefits for mom and baby. Physiologic birth coordinates readiness for birth with both mom and baby. That reduces the number of preterm births and the number of babies born without proper lung development. It decreases the length of labor and reduces pain and stress, and decreases the dangers of postpartum hemorrhage. It also benefits baby by protecting the fetus from the stresses of labor, including the dangers of low oxygen levels that's completely normal during birth. It also calms and soothes baby throughout labor, and then energizes the newborn for breastfeeding and bonding with parents. Physiologic birth also maximizes biologic bonding, which is important because it improves the outcomes for the newborn. by increasing mom's drive to care for her baby. And it does this by linking the caring and nurturing and bonding activities of motherhood to the reward and pleasure centers of the brain. These are just the high points of the many benefits of physiologic birth. I could just go on and on. And as great as these benefits are, one of my favorites is that it's not an all or nothing kind of thing. Physiologic birth is how birth works best, but it's not the only way birth works. Which brings us to how to maximize your experience through including the ideas behind physiologic birth. For a variety of reasons that are far beyond the scope of this video, most families will have a number of medical interventions in the course of their birth experience. And if physiologic birth can be thought of as what happens when birth is left alone, this medicalized birth is what happens when we do stuff in the birth process. One main reason that these medical interventions can interfere with the workings of physiologic birth relates to the body's fight or flight response. The body has two main states, the fight or flight state or the rest and digest state. The rest and digest state is regulated by the parasympathetic nervous system. It regulates the body while it rests and performs the housekeeping functions of the body, like eating, digestion, etc. The fight or flight state is regulated by the sympathetic nervous system. It regulates the body when threatened and stops all non-critical functions other than those needed to face the threat or run away from it. The body balances between these two states throughout our days. So if you're in the rest and digest state, your body thinks, oh, this is a good time to have a snack, or maybe a baby. And if you're in the fight or flight state, your body thinks, this is a good time to run away, flee for your lives. And if you're already in the rest and digest state, it's pretty easy to convince your body that this is a nice time for baby. But being in the fight or flight state can pretty much stop your labor in its tracks. It's a way of protecting mom and baby from threats during this vulnerable time. So if mom feels threatened in labor, the body's natural response is to slow or stop her labor so she can flee to safety. The problem is that the modern obstetric birth setting and experience can convince the ancient evolutionary systems in our body that there is a threat, even if there's nothing remotely bear-like happening. We're going to play a short game to show you how typical events in labor may trigger the fight or flight response. And the game is called Bear or Baby. Let's find out. Bear or baby? A bear is chasing you through the woods. And the answer is, it's bear time. Yes, because if a bear is chasing you through the woods, it is time to run away. Okay, good job. On to the next one. Bear or baby? You are safe at home. And the answer is, it's baby time. Great. If you're safe at home, this might be a good time for baby. Strong work, but of course, it's not always so easy. Let's try some more. Bear or baby? Labor begins on your due date. And the answer is, it's baby time. Hopefully, you're settled, safe at home, and not running from a bear, so this will be baby time all the way. The next one is, you arrive at the hospital. Bear or baby? And the answer is, well, it kind of depends. If you are familiar with the hospital setting and know what to expect, this could definitely be baby time. Many families feel a sense of relief when they can get settled into the room in which baby will be born. But if you're not comfortable in the hospital setting, or say your partner just drove like a crazy person to get you there, this might feel like bear time. Having a unit tour can help reduce the stresses of this time by preparing you for the process of arriving at the hospital. Okay, next one. Your L&D nurse has a lot of questions. Bear or baby? And the answer is, again, it depends. Many couples find the triage and admission process so stressful. There's a lot of activity and movement, and yes, a ton of questions. Pre-admitting, as well as making notes of important events as they happen, can smooth the process, as well as let the woman's partner or other support person provide many of the necessary details. Your triage nurse will need to know things like what time contractions started, if you think your water broke, and the last time you ate. Your labor nurse will need to know things like the name of your baby's pediatrician, any medications taken, and information on any complications or ongoing issues. Okay, this last one's my favorite. Your person is here to support you in labor. And person could be whoever it is. Think of a lot of different people, because I'll tell you, you're going to get different responses, because the answer is this one really depends. Hopefully, you've had the sometimes sticky discussions already regarding who will be supporting you through labor, birth, and the first few hours with your new baby. The arrival and presence of her support people and doula are often a vital part of what a woman needs to relax into the baby time, rest, and digest state. On the other hand, the presence of those with whom you are not entirely comfortable can keep a laboring woman in the fight or flight bear time response despite her best efforts to be calm and relaxed. Your doula can help you determine who you want to support you during labor without offending those who, for whatever reason, are just not a good fit for your support needs. And again, we're just covering the high points and basics today. There are many more common events that can trigger the fight or flight response. Prenatal classes and doula care can help you sort through these in advance so you're less likely to confuse baby time and bear time. Now, whether you're talking about the key hormones of physiologic birth or balancing the nervous system in the fight or flight and rest and digest states, it's important to realize that these systems are not entirely under our conscious control. And honestly, I'm pretty okay with that. For example, in the middle of the night, I'm probably sleeping. I'm not awake thinking to myself, hey, stomach, good job releasing those enzymes. Liver, it's your turn to make bile. And if I get awoken by a bear, I don't have to think, oh no, it's a bear. Adrenals, release the adrenaline. Or think, I need some energy to run away from this bear. Pancreas, stop with the insulin. No, I just get up and I run away from the bear because my body does this automatically. Similarly, the hormonal control of physiologic birth is not under our conscious control. We don't have to think, oh, good, my baby's lungs are ready. Let the uterine contractions begin. Or, wow, my uterus is really filling up. Better start ripening that cervix. Or, labor might sting a little. I guess I better have my brain crank up the endorphins. No, we don't have to think of any of that stuff. It just happens on its own. So these systems are not under our conscious control, but we can do things to either support or interfere with these systems. Some of the things that can support physiologic birth are choices like your birth setting and care provider, getting doula care, attending prenatal childbirth classes, being admitted during active labor, having early uninterrupted skin-to-skin time with your baby after birth, using baby-led breastfeeding, and delaying newborn tasks and routine care until after the first couple of hours in breastfeeding. And some of the things that may interfere with physiologic birth are choices like birth setting and care provider, the use of synthetic prostaglandins or oxytocin, use of opioids, epidural or spinal anesthesia, and cesarean birth, although there's some differences between pre-labor cesarean and laboring cesarean, and early separation of mom and baby. And the reason that some of these things may interfere with physiologic birth has to do with something called the cascade of interventions, which is a term that gets thrown around a lot without a lot of explanation. So I want to start by telling you, if you've read the book, If You Give a Mouse a Cookie, you know all about the cascade of interventions, because the basic idea is that one thing leads to another. The cascade of interventions is the phenomenon in which a single intervention leads to others, which leads to others, which leads to others. It contributes to the wide variety of outcomes we see in modern obstetrics, in which most women start from a similar starting point, have very different experiences, and end up in very different places with very different results. The cascade of interventions is fascinating, and I'll put up another video on it when I can. I've also developed a cascade of non-interventions, trademark me, which acknowledges all the things you can do to improve your birth experience, rather than being just a list of things to not do or to avoid. I think it's a great concept, obviously, because it's mine, but also because people like positivity more than they like feeling like they're naughty just for making a choice of their own. And because nothing is ever simple, there are times that things on the support list aren't the best choice to support physiologic birth or even appropriate for a particular situation. And there are times that things on the interfere list will overall best support physiologic birth and will produce better outcomes. It's all a case of risk versus benefit. And these are conversations you'll be having with your partner and your care providers, not YouTubers or really anywhere on the interwebs. So to summarize, physiologic birth is the normal, healthy functioning of mom and baby from pregnancy to the 4th trimester and continued through breastfeeding. There are 4 key hormone systems in mom and baby which work together in physiologic birth. You should care because physiologic birth benefits both mom and baby and produces better outcomes. Physiologic birth can be interrupted by the fight or flight response and does best in the rest and digest state, but many common events can trigger the fight or flight response. These systems aren't under our conscious control, but we can do things to support or interfere with them. Things that may interfere with physiologic birth include choices you make during your care, the fight or flight response, and the cascade of interventions. Things that support physiologic birth include choices you make during your care, staying in the rest and digest state, and using the cascade of non-interventions. It's important that you talk to your care provider and partner about the risks and benefits of all of your choices, because no matter how you look at it, one thing leads to another. So that's it for the basics of physiologic birth. For more information on physiologic birth, check out Sarah Buckley's amazing work for Childbirth Connection. There are tons of great resources in addition to the main report, and one of my favorites is The Pathway to a Healthy Birth, available as a free download in both booklet and poster format. For a personal, guided exploration of how you can best use the ideas behind physiologic birth, register for the session at Enhancing Doulas. We'll go step by step through physiologic birth, from pregnancy to breastfeeding, identifying what benefits and outcomes are most important to you, and planning ahead for your personal triggers that might interfere with your goals. You and your partner will learn how to identify the fight or flight response in one another, as well as how to transition back to the rest and digest state. We'll also plot out your best course through the cascades of intervention and non-intervention, using the personal choices that work best for you. I look forward to seeing some of you at our next session. And to everyone out there, be good and do well.